It could happen to anybody.
I just can't mentally and physically go through this again.
We're going to fight this, whatever it is.
I realized how close I came to dying.
We thought he wasn't going to survive.
It was incredibly difficult to watch someone I love deteriorate physically.
Next, two medical mysteries that defied the experts. Nicole Guerin spends years suffering from what she thinks is a chronic sinus infection, until she ends up on an operating table, fighting for her life.
I thought my life is over. I'm never going to get better, and I can't believe that this is happening to me.
Then, everyone thought marathon runner Aaron Gordon's pains were related to running. But the real culprit was something much more terrifying.
I knew in my heart, I knew in my mind that I wasn't making this up.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. In the winter of 2004, a healthy 32-year-old Nicole Guerin was enjoying an active life, juggling time between work, family, and friends.
I was always on the go, always having a lot of fun doing whatever I was doing, anytime.
Having recently finalized her divorce, Nicole was looking forward to a brand new beginning. Now she would really have the time to focus on herself and her career.
I work for a small privately owned petroleum company. It's definitely the best job I've ever had, and I'm very proud of the job I do, and it's great.
As spring arrives, Nicole braces for what she knows the season will bring.
I've always had seasonal allergies ever since I was a small child, but in March of 2004, they were unseasonably bad. I had recently moved into a new apartment and thought, well, maybe it's old filters or it's the ventilation systems.
Hoping to relieve some of her symptoms, Nicole purchases new vent covers and air filters for her home.
It seemed to make it a little bit better for a while, but I always seemed to develop another sinus infection. They weren't going away quite as easily as they used to in the past.
What Nicole believes to be unseasonably bad allergies quickly turns into a series of sinus infections that are not letting up. She eventually visits her doctor, who prescribes a course of antibiotics.
She would take antibiotics for 2 to 3 weeks. Nothing would happen. She would go back. The same thing would occur.
She would be on one regimen of antibiotics to another regimen of antibiotics, and she never seemed to be really getting any better. And that's really the first time, I guess, we noticed that maybe something was a little bit wrong.
Nicole suffers through the summer, hoping for some relief when fall arrives. But when September finally comes, something strange happens.
I noticed I was developing kind of a reddish-purple rash on my right eyelid. It came on, seemed like rather quickly, and I really couldn't figure out what was causing it.
We knew that she's allergic to red dye and thought perhaps some of the shadow that she had been using might have had that in it.
I proceeded to throw away my makeup and go out and purchase new makeup to see if that would help.
The rash on her eyelid seems to come and go, and although it eventually clears up, her eye itself becomes irritated.
I went to my optometrist. She thought maybe it was something related to allergies, but wanted to go ahead and dilate my eyes and give me a thorough eye exam just to be on the safe side. As she stood there doing the eye exam, I noticed she would go from the left to the right and then back to the left, and she really seemed to be concentrating on the left eye, and I thought, well, she's found something. She told me that she detected an area of tissue that appeared to be black. She wanted me to go and see a retina specialist to see exactly what it could be.
Nicole follows the advice and immediately schedules an appointment with an ophthalmologist who specializes in diseases of the retina.
They took many, many pictures, and at the end, he concluded I had a condition called lattice.
Lattice, a retinal condition so called because of the lattice-like pattern it creates in the periphery of the eye, arises when the blood vessels in the eye start to thin, limiting the blood supply. If untreated, lattice can lead to retinal detachment, which might require corrective surgery. But at its onset, all it requires is basic monitoring.
Once I got the diagnosis of lattice, I thought, well, maybe it's not so severe after all. I've gotten with a good doctor, and I'll just let him know if something happens out of the ordinary. Otherwise, I'll go annually and have an eye exam.
Then, after months of battling never-ending sinus infections, extreme allergies, and unsightly eye irritations, in the winter of 2004, Nicole adds yet another symptom to her already mounting inventory of problems.
Nosebleeds. I had a nosebleed every day for a month. I was really getting frustrated. I didn't really think that the symptoms with the eye and everything were connected, but I thought something just doesn't seem right.
Concerned and confused, Nicole returns to her doctor.
I was told that my nosebleeds were probably the result of running my heater so much, and I was drying out the vessels in my nose, creating nosebleeds. He suggested that I purchase a humidifier and see if that might help eliminate some of the nosebleeds.
Although she feels a slight relief from the humidifier, her chronic symptoms persist, and new ones continue to crop up.
I started to feel like my teeth were hurting. I felt like I was having braces and getting them tightened every single day. The pain I felt in my face was becoming really intense. I thought, this just can't be normal.
After a few days of growing discomfort, Nicole decides to pay a visit to her family dentist.
He thought it was connected to my sinuses, that the teeth are very closely positioned with your sinuses, and that when you have a great deal of inflammation and pain, that it can actually filter into your teeth.
In addition to her regular sinus medication, she begins taking ibuprofen for the inflammation. Unfortunately, the pain persists.
I felt like my head was a cement block. And when I was laying in bed, it was physically painful to turn over, just from one side to the other. I felt like my teeth were literally going to fall out in my mouth.
And on top of all this pain and pressure, Nicole seems to be getting even sicker.
I was again having reoccurring sinus infections, and each one I got seemed worse than the previous one I had just been treated for. I was running a low-grade fever, was starting to kind of have chills and night sweats, and at this point, I did feel like I was starting to go a little crazy.
Nicole and I, our offices are right next door to each other, so it's very easy to jump over there and help her out. And what she needed was somebody to just kind of help calm her down and let her know that she'd be okay.
I proceeded to try and go on about my life as normal as I could.
Despite her efforts and positive attitude, inevitably, Nicole starts missing work.
It was tough. I mean, she was coming in late because, you know, you feel worse in the morning, and you could walk by her desk and just see that she just looked miserable.
It did seem like I was ill more often than normal, and that my symptoms and my health were declining. I really was starting to feel depressed and discouraged and kind of starting to lose hope.
Nicole muddles through, but then, in January, almost 10 months after her first sinus infection appeared, she experiences her strangest symptom yet.
I woke up to find that my right knee had swelled up to about 4 times its usual size, and I didn't even think I could stand up on my own. So I reached for the phone beside my bed, and I called my mom, and I told her, "You're gonna have to come over here because I don't even think I can walk."
After almost a year of various sinus pain, eye issues, nosebleeds, and fevers, Nicole experiences yet another alarming symptom, which lands her in the ER. Her knee has swollen to about 4 times its usual size.
Her knee at this point was the size of a football.
They told me that they thought I had bursitis.
Bursitis, a joint condition, is an inflammation or irritation of the bursa, a soft, fluid-filled sac that covers and cushions the movement between the bones, tendons, and muscles near the joints.
And just told her to take anti-inflammatories, and it should be fine.
After about 4 or 5 days, it did get better. So I thought, well, that was just some fluke thing. I don't know what on earth caused it, but I certainly hope it doesn't happen again.
And then in April, a totally new symptom gives Nicole cause for even more alarm.
I really was starting to sound wheezy and maybe not catching my breath as fully as I did before.
She would just say she was just breathing very shallowly. Felt like she couldn't get her breath, and it hurt when she breathed.
It continues to happen for several days, and the more she coughs, the more pain she feels in her chest.
I felt like my nose burned with every breath that I took.
Nicole decides it is time to see an ear, nose, and throat specialist.
When I went, he listened to me breathe and thought, well, maybe you developed asthma, and suggested that I try an inhaler. I took the asthma medications that were prescribed, and it did seem to offer a little bit of relief, but it never really seemed to knock everything out like I thought it would.
The endless barrage of chronic conditions continues to affect Nicole's job, as well as her social life.
The month of March is my birthday. I was really looking forward to going out with my friends. We went out, but I really didn't feel well. I really tried to not let it show so much. I didn't want to bring everyone else down. I remember getting up a couple of times to go to the bathroom. I had so much pressure in my sinuses. I felt like I couldn't breathe. I felt like I was being suffocated.
You would expect a young lady at this time to be in the prime of her life and be full of energy, have a full social life, and so it's very disturbing.
All of these problems combined was really starting to take a toll on my day-to-day life. It was affecting my ability to get to work and do my job as best as I could because I was in chronic pain. I was leaving for a doctor's appointment, and that seemed like it was something I penciled into my calendar every other week.
You know, I would just always tell her, just go home. It's okay to take some time off and I'll cover for you. But for her, it was important to stay at work even though she was feeling bad.
So things are getting worse and worse and worse, and nobody seems to know what's happening. Nobody seems to be doing anything for her.
No matter what Nicole tries, nothing seems to bring relief. She begins to feel like she's turning into a physical and emotional basket case.
I was really starting to feel like I was never going to feel normal again, that this was going to be as good as my life was going forward.
A very frustrated Nicole does her best to endure the pain, exhaustion, discomfort, and general despair. Until one day, the most frightening symptom really jolts her.
One morning I woke and I felt bad, just like I always felt, and I went ahead and I got up. I remember feeling like my chest was just burning, not like asthma, but something much more intense and something deeper. And I remember literally being on my knees in front of my bathroom sink and just coughing up blood.
Terrified, Nicole immediately calls her mother to tell her what happened.
At that point, I said, you just must go to the emergency room.
I was called in to the emergency room. They said that because of the blood, they wanted to go ahead and do a CT scan of my lungs and get some x-rays, just so they could get a good picture of what was actually going on inside. I went back to my room after having the CT scan and the chest x-rays. A physician came in and she told me, we have found a mass in your right lung. And I thought, my life is over. I can't believe that this is happening to me.
Nicole Guerin has been suffering with severe allergies, fevers, horrendous sinus pain, and progressively worse respiratory issues for over a year. An episode of coughing up blood has now landed her in the ER, where x-rays have revealed a mass in her right lung.
I called my mom and I told her as calmly as I could that they did find something, that it was a little more serious than what I thought it was going to be, and that I was going to be staying for a while, and that I needed somebody to come up here with me.
My absolute worst fear was that she would have some disease and that we might lose her.
Concerned about the mass found in Nicole's lung, along with all of her other symptoms, the ER physician immediately calls in Dr. Michael Blackman, a pulmonologist.
She was in mild distress from a respiratory standpoint and was obviously concerned about this abnormality on her chest x-ray.
The worst case scenario that popped into my head is I have cancer. I never really thought it could be anything else, and I was really terrified.
I was concerned about the possibility of lung cancer because of the size of this mass-like infiltrate, as well as the location.
He told me that he wanted to perform a bronchoscopy.
A bronchoscopy is a diagnostic procedure that allows doctors to look at a patient's airway using a thin, flexible camera called a bronchoscope.
The first thing that I noticed when we got down to Nicole's throat area was that she had some changes in the area just below the vocal cords at the very top of the trachea or the windpipe. These changes were pretty subtle, but they were consistent with one of the diagnoses that I had considered when I first saw Nicole.
Afterwards, I felt a lot of pain and a lot of pressure, and he told me that they were able to take a little piece of tissue and that they were going to send it off and see if they could have pathology identify exactly what it was.
The wait is excruciating, and when the results come back, they bring no relief.
The results of that particular test were inconclusive. The biopsies that you obtain by bronchoscopy are about 2 millimeters in diameter, so there's a sampling error rate that occurs. I felt like the next step was an open lung biopsy.
A lung biopsy, or a pulmonary lobectomy, is a diagnostic procedure where a thoracic surgeon extracts a small amount of tissue from the lung in question. This procedure is radically more invasive than a bronchoscopy.
I was extremely terrified. I thought that bronchoscopy was about to kill me, and I thought, I can't imagine what this is going to be like.
When I heard she was going to have surgery, I was pretty shocked. Here's a young woman going in for surgery from what you thought was just a simple, normal bronchitis or respiratory infection, and she had some spots on her lung, and that's pretty much cause for concern.
We were very, very fearful, but here again, I just wanted to be positive with her, but we were very, very distraught. We were very, very distressed.
My worst fear was that I wasn't going to survive, and that maybe it wasn't going to be enough to do the trick. So I was really nervous.
Despite her fears, Nicole knows she has few options. On April 20th, she is wheeled into the operating room and prepared for the lobectomy.
When she had her open lung biopsy, the surgeon decided to take out the entire right middle lobe, which allowed us to make a diagnosis.
I was shocked to hear what the procedure turned out to be, and that, I had an 8-inch scar from it, and that whole section of my lung had been taken out.
But it was the removal of that entire lobe that would begin to shed light on Nicole's condition.
After the lobectomy, I had an opportunity to review the slides with the pathologist, and within a couple of days, we made the diagnosis.
Almost 1 year after her first symptom, Nicole Guerin finds herself recovering from a lobectomy. This invasive but necessary lung surgery would point Dr. Blackman in the right direction. But the pathology findings would have to confirm his theory. And when the report comes back, what it reveals is shocking.
When we looked at the samples under the microscope, we could see granulomas.
A granuloma is a collection of cells that create a localized area of inflammation in the body. They are formed due to tissue injury, which usually results from infections.
A granuloma is a result of the inflammatory process in certain diseases. She was diagnosed with Wegener's granulomatosis.
I couldn't believe it. I had never heard the word granuloma. I had never heard the word Wegener's.
Wegener's granulomatosis is a rare disorder in which the immune system, for no known reason, goes into overdrive and begins attacking healthy blood vessels. The vessels ultimately become inflamed and swollen, causing pain, ruptures, and in some cases, a breakdown in normal organ functions.
It's possible that if Nicole had not sought medical attention when she did, that the disease process may have gone on to affect her kidneys, and that would have portended a worse prognosis. Perhaps as high as 85 to 95% of people would die from complications of this disease before a diagnosis was ever made.
Dr. Blackman said that without treatment that I had probably 5 months to live with full-blown Wegener's.
It's clear now that all of Nicole's symptoms, sinus trouble, lattice, asthma, nosebleeds, and bursitis, were the result of groups of acutely inflamed blood vessels causing pain and irritation in those areas.
When a diagnosis of Wegener's granulomatosis is made, you want to start therapy as soon as possible, certainly within the first few days after the diagnosis is made. The standard treatment approach when you make a diagnosis of Wegener's initially is the use of a chemotherapeutic agent as well as medicines called corticosteroids.
The chemotherapy suppresses the body's immune system, preventing the immune cells from dividing. These are the cells that cause inflammation when the body is under attack, as in the case of Wegener's. The steroids reduce the inflammation.
I started on chemotherapy and steroids in the hospital. When I first got steroids, I felt so much better. It felt like all that pressure I'd been feeling in my nose and my teeth was just miraculously removed. This is the best drug ever.
But the relief Nicole gets from the treatment comes with grueling side effects and potential dangers.
The side effects of steroids are many. Most people will gain weight. They will have a voracious appetite, and it can worsen other medical problems such as hypertension or diabetes. Occasionally, people will develop ulcer disease.
It was not until about 3 weeks into my treatment that I noticed my hair was falling out. This is the side effect that I've been dreading, but is pretty much unavoidable. The weight gain was probably the hardest part. You always hear people talk about the moon face and the buffalo hump, and I didn't get it quite as fast, the moon face, but I definitely did get it. And it was really difficult to get up and look at myself every day in the mirror.
She was feeling a little bit better from these medications she was on, but at the same time, the effects of the medications were, you could see them, it was visual, so it was really, really sad.
I was very happy, very pleased to see that the drugs were helping and that she was beginning to feel better and feeling more like Nicole.
Looking back at Nicole's medical history, now all of her symptoms begin to make sense.
I guess in one respect, I was glad to know that this particular disease had caused all of these symptoms and all of the things that I'd been experiencing, as opposed to it being multiple things that I had wrong.
But still, Nicole wonders why it took so long to diagnose.
I think that most people who experience random symptoms don't think that they're connected.
Wegener's granulomatosis is a rare disease, and so when someone is initially seen for symptoms that can be attributed to other medical problems, Wegener's is not often thought about. The advantage that I had was that Nicole had already been seen by a number of other doctors, and she presented with symptoms that made the disease process more recognizable.
In time, and despite the many challenges of her treatment, life slowly resumes for Nicole.
It takes a strong person to be able to just kind of move on through that and look for relief and look for remission and getting better.
Getting diagnosed, I think, is half the battle. It seems like once you've gotten that in hand, then you're given the proper treatment, and as long as you take your medication, as difficult as it may be to swallow those tablets, it's the difference between life and death.
She knows how lucky she is at this point to be here today and just to make the most of each day. It does make you stop and think that you're just not sure what the next day can bring.
This experience has definitely changed my outlook on life. There's no cure for this disease. It's just a matter of controlling it. I'm going to have to learn how to live. My life is going to be different from here on out.
While Nicole's condition would severely impact her health and day-to-day routine, Aaron Gordon's illness would also compromise his lifelong passion. 39-year-old investment banker Aaron Gordon had always been active. In fact, more active than most. Aaron was a marathon runner.
I was running marathons essentially since 1984. Marathon running actually takes your mind to a place that you don't normally or typically actually get to go in everyday life. It's the one thing that no one can take away from me. My idea back in '84 was to run a marathon for every year for the rest of my life, and that would be my way of actually staying in some semblance of shape.
He loved sports, and he was always very active. Couldn't hold him back.
Aaron was well on his way to fulfilling his goal. And in 1998, shortly after his wedding, he ran his fastest ever in a marathon, 2 hours and 53 minutes.
My life was actually pretty much about as good as it could get. I had great outlook on life, very physically demanding of myself.
But later that year, for no apparent reason, Aaron started feeling a little odd.
I was starting to slow down in a way that I didn't feel was my fault. I was starting to feel like I was just being plain lazy.
What I noticed initially was he was very tired a lot of the time, which was unlike him.
Then, in October 1999, Aaron runs his annual marathon, but he notices something is different this time.
It just felt as though I was just basically running on a skeleton. The bones just feeling like they're so stiff, like they need oil. And I'm not providing enough oil for my joints, and it was only a matter of time before these bones were going to break down.
The next day, the pain is gone, but Aaron pays a visit to his doctor anyway.
What I remember when Aaron came in is he was quite run down and tired. And I think when a patient comes in with just a complaint of fatigue, that it's often very difficult to hone in on any diagnosis right away. We explored a number of issues. Is there a lot of stress at work or at home? Are there any other symptoms that go along with the fatigue?
When I thought about it, I kept looking at it and saying, God, I'm having the time of my life. I'm actually really enjoying myself, but I'm not getting 100% out of it, and something's wrong.
Aaron is prescribed ibuprofen for his joints, but it does little to soothe his pain. Around this time, there's another unusual development. Aaron's friends begin to comment about his appearance.
People would say in the middle of the winter, why do you always look like you have a tan? And I didn't know what to attribute it to other than maybe my family being of Irish descent, your skin's more sensitive to the sun. I couldn't put my finger on it, but I was definitely getting that comment, and I'm certainly no George Hamilton.
I was not sure what it was. It almost looked healthy, which is very deceiving.
A month later, Aaron enters another marathon.
At the end of that race, I remember walking more than I was actually running, and it was really because that's about all I could do.
I knew that in the past, Aaron had completed these marathons in a relatively short amount of time. And as the time clicked on, I became more and more nervous because he was not crossing the finish line. I knew something was wrong.
I knew I was going to have some trouble. I just didn't realize it was going to be as bad as it was. The best way I would describe it is what it feels like when you chew on aluminum foil. Just absolutely excruciating.
Aaron gets through the race and assumes he'll feel better once he stops running. But this time, the pain stays with him.
I just felt like you would normally feel like at the end of a marathon. I've been out there for a couple of hours, but I also feel like, something's wrong. Couldn't put my finger on it.
Frustrated, Aaron returns to Dr. Auerwater, who isn't sure what to make of the symptoms.
There's a medical term called arthralgia, when a patient might complain of very severe pain, but we can't really see anything visibly. So certainly joint pains that are new to that degree that would prevent running in someone that had been previously a runner, several things come to mind. Wear and tear issues. Someone that had been an active runner could often have problems with their cartilage and so on.
I would either take ibuprofen, there was some other arthritis-related medication I was taking, but nothing seemed to actually make a difference.
It became more and more frustrating because you really felt powerless to do anything to help him.
Aaron continues taking huge doses of ibuprofen to no avail. The pain not only intensifies, but now he notices something else.
my left elbow was starting to crack. I would describe it as taking a broomstick handle and basically snapping it. And then I started having trouble with knees, ankles, hands. As time went on, that got worse.
By winter 2000, Aaron is not able to run at all because of the excruciating joint pain.
I remember one day in particular just going out there and running, for about probably no more than 5 or 10 minutes and just saying, this is not going to happen. I don't have the energy to do this. How in God's name am I going to run for an hour if I can't even run for a couple of minutes?
I think this was devastating because he really loved to run and could run good.
I certainly felt fear that we wouldn't find out what was wrong with him and he would just continue to deteriorate.
Never in a million years would have thought that, at 38, 39, 40 years of age, I was going to start feeling like I'm 80 years old and I'm losing my mind.
For the past 2 years, longtime marathoner Aaron Gordon has been plagued by intense joint pain and fatigue. It has gotten so bad that he's been forced to give up running altogether.
I would go out and try running around Federal Hill in Baltimore, and it was really a bad attempt at what I would normally think of as something that would come very natural to me. So I would go out and run, but come back very frustrated.
Despite significantly reducing his activity level, Aaron continues to develop strange symptoms.
I would start to get this pounding in my heart. That, you get this rapid heartbeat. It was very irregular. And it would last for probably about 30 seconds to a minute, and then I was just exhausted. That was pretty scary. My heart is pounding so fast after having not done anything to cause that to happen. Is this going to slow down and go back to normal, or is this the end?
It was very frustrating to watch someone you love be that sick and not be able to do anything to help them and not know what is wrong with them.
You hear about people having heart attacks, you hear about people having strokes, or whatever it is, and I have no idea how that must feel. But the only thing I could think of was, I'm dying. I know I'm dying. I had resigned myself that at this pace, there is absolutely no reason why I'm going to see 80, let alone 60 for that matter.
Aaron makes an appointment to see Dr. Atwater about his racing heart. But one morning, in the intervening days, he notices something bizarre.
I just remember looking down my chest one day and just feeling like the right side of my diaphragm is out further than the left side, and it just didn't seem right to me.
All around his upper torso was so big, and that was not him.
I encouraged him to continue to go to the doctor.
Scared and now certain that these new symptoms cannot possibly be stress-related, Aaron returns to his doctor.
His liver seemed to be enlarged on examination. We decided to run some laboratory tests. What came back was a slight increase in 2 of his liver function tests, often referred to by physicians as transaminases, 2 very common measurements looking at liver inflammation.
But the liver is tricky. Its day-to-day function is easily influenced by the most mundane things, such as food intake, alcohol consumption, and weight gain.
An enlarged liver could have many reasons. The liver could be not working very well, could be the source of the fatigue. When people gain weight, it becomes a fatty liver. Fat accumulates in the organ and enlarges. There are also autoimmune diseases that can inflame the liver. And of course, liver tumors, cancers, metastatic diseases can land in the liver and cause that organ to enlarge. So there's many different explanations. You still don't have an answer.
But by the end of summer 2000, none of Aaron's symptoms have abated. His depression mounts and his focus is scattered. He has no energy and cannot even fathom exercise. As a result, he starts to gain weight steadily.
Being 165 pounds And eventually getting up to about 215 pounds was pretty shocking. You're looking at a kid who, for most of his life, was being accused of being too skinny and really needs to eat more. Now, all of a sudden, it looks like I'm making up for all that time, and physically, that starts to take a toll because it starts to hurt.
We knew this illness is really doing a thing on him.
Aaron's decline becomes a vicious cycle, where the depression, weight gain, pain, and lack of exercise all feed each other. His doctor suggests that perhaps Aaron's pain might be psychological.
While I didn't know what was wrong, I certainly wasn't stressed out. I certainly wasn't in need of therapy.
I think as Aaron's symptoms became worse, he became more and more depressed. It became almost a perpetuating type of situation.
Seemed like he was down in the dumps, and we knew something was bothering him.
I didn't want to do anything. I didn't feel like I could do anything. Emotionally, absolute disaster. Just felt rock bottom, no enthusiasm, no excitement.
It made his condition that much more frightening because we really had no idea what was wrong.
When I look back on my life, I can actually tell myself that there was a point when I just basically said, I don't care how this turns out because I just don't feel good. And really not too much of a desire to live. And that was not a good place to be.
For years, marathoner Aaron Gordon has been suffering with a series of bizarre symptoms: joint pain, heart palpitations, fatigue that no one can figure out. It has brought this once unstoppable athlete to his knees.
I knew in my heart, I knew in my mind that I wasn't making this up, that something was seriously wrong. In the beginning, it just seemed like I'm feeling funny. Well, now I'm not feeling just funny. Now I'm feeling like a physical and emotional disaster.
Very much aware of Aaron's distress, Dr. Auwaerter is equally frustrated.
Well, I think Aaron and I both wanted to come to some kind of diagnostic conclusion as soon as possible. I think when someone's not feeling well, you'd like to try to figure out as soon as possible.
Determined to solve this mystery, Dr. Auwaerter pores over Aaron's records, revisiting every symptom. An inflamed liver, heart palpitations, cracking bones, a year-round tan, and joint pain. Then, in January of 2001, he calls Aaron back into the office to answer one critical question.
I remembered he mentioned some joint pains, but we didn't spend a lot of time going over them in the office. It's not something I usually ask a person in their 30s or 40s, unless if the patient volunteered. I asked him which joints hurt him the most. He described the fact that his knuckles, specifically the first and second knuckles here, were particularly troublesome for him.
When my doctor asked me about how my fingers felt, I thought to myself, where did that come from?
Many of us learned about this particular area as being an unusual form of arthritis during our medical training.
My reaction was they're sore. They feel like they have arthritis, but I've felt that since the early 90s. I always wrote it off as attributable to falling down snowboarding or skiing and things along those lines. But he asked me, do your first and second fingers hurt? And I said, absolutely, they've been hurting for years.
And that really was the light bulb moment. Only a few conditions sort of isolate themselves to that area.
But a hunch isn't a diagnosis. Auwaerter will need to confirm his suspicions.
Some additional tests were ordered that specifically looked at some other factors that can go along with this condition, such as iron levels.
In just a few hours, the results are back, and Aaron's iron levels are through the roof.
So in Aaron's particular case, the fact that he had fatigue, the joint complaints, the abnormal liver function tests, as well as the elevated iron levels, the diagnosis that seemed to be most likely was a condition called hemochromatosis.
I was shocked. I had never heard of this word before, let alone probably knew how to spell it.
Hemochromatosis is a genetic disorder that causes the body to absorb and store too much iron. If too much iron builds up in the blood, it starts depositing in skin, joints, and other organs, slowly destroying them. Doctors believe that approximately 1 in 250 people carry the hemochromatosis gene. However, only 1 in 5,000 will actually develop symptoms as severe as Aaron's.
If there was not a diagnosis, the iron would have accumulated and potentially damaged his pancreas gland, his heart, and certainly caused problems that were no longer reversible.
If Aaron had not been diagnosed, it's possible he could have died. The disease is most often diagnosed at autopsy.
Doctors believe the HHC gene might have evolved among Northern European peoples as a built-in defense mechanism against a largely agrarian, low-meat diet.
When we realized it could be from some part of our family, then we felt bad, really bad.
Despite the genetic traceability for hemochromatosis, it remains a difficult condition to zero in on.
I think the challenge for diagnosing hemochromatosis to a physician is probably the earliest symptom is something that we would call nonspecific, that is fatigue.
Aaron learns that the peculiar treatment for his HHC will have to become a part of his regular routine.
The treatment is an unusual treatment. Doesn't involve a pill, doesn't involve an injection. The treatment is phlebotomy.
Phlebotomies.
Phlebotomy.
Phlebotomies?
When my doctor described what the treatment was, it just seems so
Barbaric.
medieval.
Terrific.
Phlebotomies. That's a nice label for bloodletting.
The best way to remove iron from the body is to stick a needle in a vein and remove a pint of blood as frequently as you can, not making the individual too anemic or too tired.
And I was going to actually have a unit of blood taken out for about a year, every week. That sounded pretty radical because most people don't give blood, more frequently than every 8 weeks.
We thought, well, if this is what it takes to get him through this, great.
As the phlebotomy treatments progressed, his symptoms got better. He seemed to have more energy. He seemed to have a better outlook on life.
Laura said to me, "I think you woke up." And I said, "I think I did too."
Today, Aaron receives his phlebotomy treatments from the National Institutes of Health, where, like many other patients with hemochromatosis, his blood can be donated to others in need.
The most important thing that Aaron learned from this ordeal was to believe in himself, set his goals, and fulfill those goals.
Aaron, in typical fashion, not only decided to overcome his disease, he decided to set goals that were probably far beyond everybody in the United States population.
By the end of 2003, with his ongoing treatment, Aaron decides it is time to reclaim his life.
The great goal that I had always had in my life was running a race called the Marathon des Sables, which is a 150-mile race in the Sahara Desert. There was no question about it that I had gotten it under control. And if I can get this under control, then I want my old life back.
In April 2005, Aaron successfully finished the Marathon des Sables.
Few people in the world actually ever run 150 miles in the Sahara Desert, but I did it, and I have hemochromatosis. It was my way of saying, I'm back.